recording. Good morning, Angelo. How are you?
Good morning. I'm fine. Thanks for having me today.
It's a pleasure. It's a pleasure. How did we meet? Oh, you showed me the textbook you had written, which we're going to talk about momentarily. And well, because it happens to be on one of my favorite topics, which is piezo surgery.
Yeah.
And I would venture to say that a lot of endodontists are using it. I think piezo and Trefine will be standard of care in endodontic microsurgery probably within the next 5 years. So I'm going to pick your brains. I'm going to go up here and have you teach me about piezo in a little while. But I want to talk to you about your journey to becoming who you are today. You're 36 years of age. You've published extensively, and you've written a textbook. That's pretty cool stuff, my friend. That's pretty impressive. So you practiced in a Cernia, which is, can you tell me, this is a picture of it, or is it behind me, I guess? Okay. So you said it's a small town. So can you tell me about it, what its history is, where it's located? Obviously, you grew up there. So if you could just share with everybody your background.
Yeah. Thank you, and congratulations for the picture, because this is the emblematic picture of my city.
Okay.
Yeah. Yes, I was born in 1983 in Isernia. I studied in Isernia, and I did study general dentistry in the south of Italy, in the city of the south of Italy, L'Aquila, in Abruzzo, close to my hometown, about 2 hours from my hometown. And I took there my bachelor's degree in general dentistry. And after 5 years, I moved then in Rome, where I specialized myself in oral surgery in the famous university in Italy, Sapienza University.
Right.
3 years later, my specialization in oral surgery, and at the same time I have been working as oral surgeon in my private office in Isernia, in Clinica Cardarelli, where I actually work with my brother and my father, family dentistry.
Family dentist. Okay, that's interesting. That's great.
Yeah. So I had the opportunity to work with my father, with my brother at the same time during the years in amazing city like Rome.
Yeah.
This is a very fantastic city, and I had a fantastic experience with the professional approach, and I know many friends during this time in Rome. I love Rome. And after 4 years, I come back in my city, and I dedicated my time to work in my clinic. But I had a big opportunity, a big chance 9 years ago to start to work in one of the best hospitals in Italy and in Europe, and one of the best university, I think, in Italy, the San Raffaele University. And working in the hospital gave me the opportunity to perform as a teacher professor. Mm-hmm. And I'm very proud for that, because I'm still very young, and for me it's very important to teach to my very young students. I'm very proud for that, and this is my passion. I love the surgery, I love my work, this is my passion. I think it's very important to have a strong passion in our practice to obtain a good result in the private practice, but also in the public assistants, like the hospital assistants and like the university, because I think it's very important to have a good multidisciplinary view in this in this profession. It's very, very important. And also, as oral surgeon, I think is very important, and I had a good opportunity in the San Raffaele Hospital to improve my knowledge, my skills, to treat many patients from a simple case until to the extreme case about the oral surgery, the implants rehabilitation, about the treat of the lesion in the jaws. And I think it's very important in the knowledge of the oral surgeon skills is very, very important. And giving me a great opportunity for this aspect to work in the San Raffaele Hospital. And at the same time, 2 years ago, I decided with my brother to make in my clinic an academy, a Clinica Cardarelli Academy. And we are hosting, before the coronavirus crisis, we are hosting some courses, theoretical and practical courses, about not only surgery, not only implant rehabilitation, but also about the orthodontics treatment, because my brother is orthodontist. And from 2 years, we are start this adventure, and but the situation actually is very difficult around the world about the coronavirus crisis. And I hope the situation will better very soon in Italy also, but around the world. And about my new experience, is very important for me to know and to meet some important expert in about the surgery, about the bone regeneration, like, for example, Dr. Arungarg. I had the opportunity to know Dr. Arungarg. Without doubts, I think that Dr. Arungarg is the best form in US and also the ideator of the PRP approach protocol.
Yes.
It's very important, this aspect. And I'm honored to learn from him and to improve from him my knowledge and my skills. And I meet Dr. Arungarg in last December in San Francisco during my hands-on training course in his International Dental Symposium, because he is also the president of the International Dental Implant Association, a very big academy to organize some webinars, some courses, some lectures around in different places of the US. And from this time, I had the opportunity to collaborate with him about the courses, about the lecture, about actually we are hosting according to the critical situation. It's not impossible to do the hands-on course and the lecture. We are hosting some webinars with his association, and also with Dr. Arungarg, we made the first textbook dedicated for the piezo surgery treatment of impacted teeth. And this book just came out in Italy 1 month ago. And in the next months, it will be available also in English version by the preface of the Dr. Arungarg. And thanks again, Dr. Arungarg, for helping me in this work, because it's very important to have also an English version to send around the world, the knowledge around the world. And it's very important to have the support of Dr. Arungarg, because I think he's a very impressive teacher, very impressive former in this aspect, especially in the surgery, in the bone regeneration. He published some books about the bone regeneration, about the sinus lift, and for me is a very important support. And I decided to write this textbook because at the beginning of my practice, of my job, I dedicated some time to the extraction, to the simple extraction until to the complicated extraction. about the impacted teeth, about the included dental elements. So during the year, I improve my knowledge and my skills about this particular surgery, because I think it's very important for the general dentist to have a good protocol, a good approach also in the extractive surgery, because frequently the general dentist don't do the extraction, don't do the approach of the impacted teeth, because he think that is a very aggressive and very hard surgery. But I think it's very important to have a good protocol to obtain a good result also in this surgery. So during the year, I started to develop a good approach, a minimal invasive approach, because I think the future in the treatment of our patient is to reduce the invasivity and to reduce the morbidity for our patient, obtaining the same outcomes, to reducing the operative time, to reduce the invasivity, is very important, especially because in the latest year, also the numbers of the people with the dental problem is increased in the latest period. Yeah. For example, about the edentulism is increased, and there will be, according to many studies, in the next years, there will be about 30 million, for example, of edentulous people in one or in both arches. So it's very important to select a right technique to treat this patient, but at the same time to reduce the invasivity. I think this is our goal.
Is this why you went to the course in San Francisco? Dr. Garp he's going to be speaking on Wednesday, and I wish I had the entire day with him. I've been speaking to his, I assume she's the executive director of his institute. Probably, but I haven't really asked. However, when she sent me the CV, I kind of sat there and went, oh my God, right? And an extraordinary gentleman, obviously. And I think what you hit on, which I really find amazing, and it's consistent with what this is about, is he is a mentor to so many people. It's just unbelievable. I do not know where he finds the time to do all this. But for example, you're 36, right? You go to a course in San Francisco, 2019, December, right? And all of a sudden, you are part of his institute. You're lecturing, you're doing webinars. Can you talk about that in terms of the scope of his online education and how insightful he was? Because March, whatever it is, 1st, all of a sudden there are 25 million webinars on the internet, right? So how did he approach you with regard to that? What was, your interest was obviously academic, but when he talked to you about doing this, how was this set up? How did you get involved? I'm just curious to how someone builds these online institutes.
Yes, I think it's very important, especially in this period, to don't stop the training education. Is very, very important. And I think that the webinar formation is very important in this period. And Dr. Gar organized a very good webinars during this period about different topic to give the opportunity for all attendees to spend some of free time to increase, to study some aspects, some topics about the regeneration, about the endodontics treatment, about the use, for example, of PRP. And for this reason, I think when I went in December, I was very impressed from the organization of Dr. Aaron Garb's Academy. Very, very outstanding organization. In fact, he did and he will do in the future many courses every day, every week, is very, very impressive. Live surgery and hands-on training, because also he do many courses about not only the lecture, but also with the hands-on training, also with the cadaver dissection, because I think it's very important, especially in oral surgery approach, to have the knowledge of the anatomy structure. Is very, very important. And for this reason, he do many courses also on the cadaver dissection to show the anatomy, to show the flaps design, to show the good surgical approach. And this is very important. It's different. In Italy, we haven't more courses about the hands-on training. We have many courses about the lecture, but I think it's very important, especially for the surgical approach, to have a good hands-on training, a good practical approach. And I think this is the goal of the Dr. Arungar's organization and academy. And for the same reason, and I'm glad to be part of this academy, this is also the International Extraction Academy of California.
Right. And that's his as well? He's involved, I know it's him and Keanu Shaw, right?
Yeah. Keanu Shah. Thanks, Keanu Shah. This is the dean of the International Academy. This is the academy to organize some courses, some lecture about the basic of the extraction, to also about the implantology, about the endodontics treatment for general dentists, for oral and maxillofacial surgeon. And next week, with the International Academy, it started the 5th International Global Symposium online, the very with many attendees during those lectures. I think is a very good idea in this period to do the international symposium with over 70 countries, with over up about 100 international speakers from different places around the world.
And you'll be there? You're one of the speakers at the IEA?
Yes, I am one of the speakers. I did my lecture in next Tuesday, about the same topic, piezosurgery treatment of impacted teeth.
Okay.
1 hour lecture about this topic, and I hope in the future I will go in California for the International Extraction Academy to do some courses about this topic. Because in US, the use of a piezosurgery device for the extraction is not most common.
No.
Yeah, it's not most common. So I think it's very interesting to introduce this approach in our practice, because it's possible to reduce the operating time, and to obtain a good result using this device, not only for extraction, but also for implant placement, for bone regeneration. And don't forget that the ideator of the piezosurgery device is the Professor Tommaso Vercellotti, Italian professor from Genoa. And he's the inventor of the piezosurgery device. He introduced this device some years ago, started from the ultrasound vibration, and to develop this approach until to obtain a good device using an ultrasound vibration. And the goal of the piezosurgery device is to do a micrometric cut, a select cut using a particular tips with different shape according to different type of surgery. This is very, very important. For example, in US is most common the use of the PRP. Instead, Italy is not most common. No. But I think because in Italy we haven't a good protocol, a good approach to use of PRP, because I think the PRP, with the PRP, it's possible to increase the healing of the soft tissue, the healing of the bone during the bone regeneration. But in Italy, actually, it's not the most common, the use of the PRP. So in the next future, I hope to improve my knowledge about the PRP in US from Dr. Arongar, the father of the PRP treatment.
Right. 25 years ago, I think, and Dr. Marks and Dr. Garg, those were the two people that really set it in motion. It was impressive because, let's see, I don't know when Dr. Chacroun, I don't know, like I started well, first of all, it was Eduardo Anitwa, right? In Italy? Is that where no. Dr. Anitwa is from...
Anita is Spain.
It's in Spain, right. So he's from Spain. He started doing, I guess, either IPRF, APRF, or one of the PRFs. I don't really know. And I know that he became very involved with Dental XP, Maurice Salama, his group. That suddenly became, it jumped out. Suddenly people were aware of it. But it's interesting. That was, I don't know, 2000 and something, maybe 10, 12 years ago. But to think that Dr. Gar's been doing this for 25 years, that's incredible. I'm just curious, Italy right now. I mean, I know it's on lockdown. I realize that it's horrible. People up north are dying from COVID. But when things are normal, all right, things are normal. What's it like to be a dentist in Italy? Is it like, I was speaking to somebody yesterday, I think, and he was saying that for young dentists coming out, it's incredibly slow. There's just so many dentists. And it's like you have a town of 20,000. So what's it like if you're a young dentist graduating? What can you expect?
In Italy also, we have many dentists, many young dentists. But at the same time, we have another problem. We have many low-cost clinics in Italy to propose not good therapy. For example, is most common of the all-on-4 concept in Italy. Okay, to remove the good dental elements to place for implants to obtain a good money. Okay, and I think it's not a good approach. But now in Italy is most frequent to find this approach. We have many low-cost clinics. We have many dentists, but we have many low-cost clinics. So the quality is very low, and the knowledge and the experience of the young dentist is not very good, because many young dentists work in this low-cost clinic. And in this low-cost clinic is very important, the business, not the health of the patient. More money, but it's not important to follow the protocol, to improve the experience of the young dentist. This is a very important problem, I think. Also because the economical situation is not good, especially in this period. In Italy is absolutely not good, especially in the south of Italy. So we have many people who don't have the money for to care your health.
Right. So you're
important to change this approach.
So when you're teaching, you're an adjunct professor and a tutor in San Rafael. You fly up to Milan to do that, and you're an advisor. So you've got all these young people in programs, right? They want a future. They want to aspire. I mean, you're 36, so you graduated what? When you were in your 20s, 26, 27, right?
In 2007, I graduated.
So 13 years. So you've got all these people that you're teaching, mentoring, and when they're done, what happens? What do they do? You know, it's you're suddenly here. I've got this degree. I've learned my baseline, and now I want to grow. I want to learn. I want to, practice. I want to get better. What do they do in order to get going?
Yeah, actually, I think the wrong approach by the young dentist is to, after the bachelor degree, to immediately to start with work to obtain money. but this is not a good approach, because after the bachelor degree, it's very important to obtain a good knowledge, a good practice in the, for example, to work in the hospital, in the clinical structure, to treat many different clinical cases. Is very important. Is very, very important, especially for surgery approach. It's very important to have a high experience before to start to work in our office or in other clinic in Italy. So I think it's very important for the young dentist, before to start to work, to spend some time, a lot of time, to increase your knowledge. It's very, very important. In the hospital with the private course, because don't forget that in Italy we have many famous and many very good dentists.
Yes.
In prosthetic technique, about the surgery, about the endodontic treatment. So we have a great opportunity to learn from their the knowledge and the experience. So it's very important. I suggest there to spend some time to the knowledge before to start to work, and don't work in this low-cost clinic, because this is not wrong approach. This is not good approach, because the quality is very low. Is very, very low, and is very important. Don't forget that we are the doctors. So it's very important to have a good clinical approach with our patient. The diagnosis is very important. Before the diagnosis and after the practice is very, very important. So when it's possible, our goal is to save the teeth before the extraction of the teeth. It's not the good approach to remove the teeth to place the implants. Because the implants is the last.
It's the last, it's the last recourse.
Yeah.
Is there dental insurance in Italy? Do your patients come to you? Does the companies have insurance? Do they provide benefits to your patients? Or is it just strictly their own money? They don't subsidize. You don't have to fill out forms and submit it to an organization. Is there anything like that in Italy?
In Italy, it's different. We have a private patient without insurance.
Without insurance?
Yeah.
Wow, that must be difficult.
A little bit with the insurance, but many patients are a private patient without insurance. It's different than US.
So talk to me now about piezo surgery. As I was pointing out before, somewhere I've got this. I've been working, or at least become familiar with, a woman named Paula Villa in Colombia. I met her because she was using dynamic navigation. Let me see if I can show you what she's been doing. And this is it right here. Okay, so this was dynamic. And you can see she's, all right, this is dynamic here. But you can see how she's monitoring. Now this is endo, so she's monitoring the whole part of the, she can see it in sort of the Z-axis. So she's got real-time feedback. Okay, this is endo. I appreciate that, it's not everybody's thing, but she's doing the resection. There's been a missed palatal canal, and there's an obvious lesion. But the fact that she can do this, and because it's a piezo, even if she comes close to the sinus, there's no risk, right? Because the piezo won't cut the sinus, the membrane. So when we talk about piezo, different types of bone, different saw tips, different management in terms of the saw tips, this, that, and the other. So when you started doing this, you've written a book on it. So, and again, 36 years of age, you've written a textbook. That's outrageous. So tell me about piezo. How do you adapt it? choices, all the things that relate to actually changing from a handpiece to a piezo. Like, what is the learning curve, the adaption? And obviously it's all in your book, which, hold on now, let's be fair to you. Just bear with me. And there it is. All right, so, whoop, wrong one. Hang on for a second. Let's go back. I want to show your book.
Yeah.
Okay, so that's right, I did it the wrong way. Okay, this should be your book. And there it is.
Okay, thank you very much.
Okay, so there's Dr. Gard, and Edra, I take, is the publishing house. But, you know, piezoelectric surgery of impacted teeth, so the focus on it. I mean, realistically, the majority of surgery done by oral surgeons here in Canada or in the United States is removal of what they call whizzies, right? Everybody's got a whizzy to take out, 4 whizzies, and that's the staple of the practice. However, increasingly oral surgery, not just implants. I was speaking to Dr. Stefanelli the other day, Luigi Stefanelli in Rome, and you know he's doing pterygoid implants, advancements to the lower jaw, orthognathic surgery. They're using piezos to do, the hell's it called? Vertical. When they do ortho, right? To speed up ortho, they do vestibular, yeah. So there's so many applications, rid splits. You can, granted, most people are, the shift is to densibers to do sinus lifts, but if you're doing lateral windows, piezo. So talk to me about how this became your go-to instrument when you're doing surgical procedures.
Yeah, I think the use of the piezo surgery has many advantages in our practice. And I had the opportunity to start with the piezo surgery approach 10 years ago. So during these years, I had the opportunity to increase the knowledge with the use of the piezo surgery approach, because the use with is a little bit different respect to the traditional drills, for example, contriangle or straightened piece. Also, for example, the pressure on the head of the straightened piece is different. Some grams on the piezo and 2 or 3 kilograms on the head of the straightened piece, different pressure. So it's possible to know that different pressure, with different pressure, to reduce the pressure, it's possible to obtain a very micro-invasive approach. The main characteristics about the piezo surgery device are the micrometric cut. In fact, using an ultrasound vibration, it's possible to reduce, for example, in case of the approach of the lower teeth molar, the ostectomy around the crown to preserve the bone. For example, during the extraction of the ankylosing teeth, it's possible to remove with the particular tips in close contact between the enamel of the crown and the bone to preserve the bone, to create a good space between the tooth and the bone, and to use the luxator with the minimal traumatic approach. And at the same time, it's possible to place the implant to preserve the buccal bone. It's very, very important. For example, for one approach in our clinical case. Another characteristics about the piezo surgery device is the selective cut. Using a different ultrasound vibration, it's possible to have a selective cut on the hard tissue to preserve the soft tissue, like the nerve, like the muscle, like the sinus membrane. And also using the saline irrigation, another characteristic is the hammering action. So using the irrigation, it's possible to reduce the bleeding in the surgical site, and reducing the bleeding, it's possible to achieve a good surgical view. And it's very important to reduce the risks, to reduce the problems during the surgery and after the surgery. And also using the ultrasound vibration, it's possible at the same time to clean the surface of the tips, to reduce the the necrosis around the soft tissue and around the bone. Those are the main characteristics about the piezosurgery device. And also, we have many histological studies to show that the use of the piezosurgery device reduces the necrosis around the cut of the bone and to increase the healing of the bone and the soft tissue. Because Bercellotti, he used for the first time the fist piezosurgery insert to remove the ankylosing scanning. And after removing the ankylosing scanning, at the same time, he placed the implant. And after 3 months, he noticed that the healing of the bone around the implants is very, very high. So by this moment, he developed this approach and made the actually piezosurgery device. So the piezosurgery device made with the extraction technique about the ankylosis roots, because the extraction is a very important approach. Because if I don't use a correct approach for the extraction, it's not impossible. For example, I mean in the aesthetic zone, after the fracture of the central incisor, if I don't use a minimal invasive approach to preserve the buccal bone, it's not possible at the same time to place the implant, for example.
Right.
So it's very important. So the first important step is the extraction, and also the correct use of the different luxator, different forceps in the extraction site. And also using the piezosurgery device, in some cases, it's possible to do the extraction with also flapless approach.
Okay.
Don't reflect the flap, but using with the high irrigation, water saline irrigation, I use a close contact between the crown and the bone without flap. So
you go right through the soft tissue, do what you need to do. Really?
It's very selective, but it's very important to use a very important irrigation to avoid the increase the temperature of the bone and to reduce the necrosis. It's very, very important. So it's very important to have a good knowledge and skills about the use of the piezosurgery device. Because one disadvantage, for example, is the surgery time. Because instead, the straight and the piece, it's possible to work with the quickly approach. It's very quick in the ostectomy, for example. Instead, the piezosurgery device can't work quickly. It's slowly.
Very slow.
Yeah. So it's very important to obtain a good knowledge experience and avoid the use of the excessive force on the insert.
So if you were a general dentist that had just graduated, would that be something that you would purchase immediately, just because of the obvious efficacy that it provides?
I think it's very important to start very slow with the piezosurgery approach. For example, with the simple extraction, with the ankylosis roots, simple case to obtain a good skills about the use of the piezosurgery insert. But I think it's very important. I think every oral surgeon should have a piezosurgery device in your office.
In the office. We're gonna have to wrap it up, but I have 3 questions. Well, one question and 2 comments. I have no vested interest in the companies that manufacture. There is I was with Scott Ganza and Isaac Tawil. There was a gentleman there who has this. It was amazing looking. I mean, obviously effective. And for the life of me, I can't remember it. I'll ask Scott. But the one that comes to mind is Acteon. Do you have a specific favorite for some reason? I mean, the only thing I've seen here is the Acteon Cube, which is very popular. Is there a reason to choose one unit over another? One piezo surgery unit, one system?
Yeah.
Or by another one?
Yeah. In my practice, honestly, I use always I think this is the best one by Mectron because
Mectron.
yeah,
That's
because,
that's what I saw. That was like it's black on the surface.
The
Fantastic.
yeah, because the ideator of the piezo surgery is Tommaso Vercellotti, and Mectron is
It's his company.
Yeah, the same company of Tommaso Vercellotti, the ideator of the piezo surgery device. So I think I tried the different device, but I think the best one is the Mectron because it has a good power, a good irrigation, a good shape of tips. So it's very important to choose a good device.
Yeah.
And I think in my practice, I try different device, but the best one is Mectron.
Okay. So before you go, I want to just remind everybody that you are going to be lecturing at the International Extraction Academy of California on the Tuesday. What's the date?
Last Tuesday.
Oh, you lectured last Tuesday. Okay. All right. Good.
Possible to, but it's possible to see again on the Facebook page on the International Extraction Academy.
Okay. Okay.
The lecture.
Fantastic.
And sorry, the next week, next Tuesday, I will do the lecture about the piezo surgery device with the piezo surgery company of Michigan. On my page on Facebook, I will do 1 hour.
On your page.
Yeah, DDS or surgeon page with the piezo surgery Michigan.
So your page, I'm sorry, I don't mean to interrupt. Your page is Angelo Cardarelli on Facebook. That's
fan page is DDS Angelo Cardarelli Oral Surgeon.
Okay, great. And the book. Do you have a link to the publisher? It's an online. How do you buy it if somebody wants to buy it? Oh wait, it's in Italian right now.
Yeah, now it's in Italian, but the next month it will be available in English, and it's possible to buy on Amazon, on the internet.
Fantastic. Okay, so when it goes online, let me know and we'll post it on Access. Okay. Not that Jeff Bezos needs any more money, but that's okay. We'll make sure you're taken care of. All right. Thank you so much for this. Be well. Dr. Gard, I'll send your regards to him when I speak to him on Wednesday, and look forward to hearing from you again sometime. Thank you for this, Angelo. I really appreciate it.
Thank you again. Thank you very much for your kind invitation, and I hope to meet you very soon in Toronto.
Well, that'd be great. Thank you. Again, not the only reason I asked you to come on, but you're 36 and you've already started to mentor young dentists, which is, in my book, that's outstanding. Good for you. Good for you. Okay, my friend, you have a good day. Take care. Okay. Bye-bye. Bye.